So what is foot rot? Foot rot is a subacute or acute necrotic or decaying infectious disease of cattle causing swelling and lameness in at least one foot. It is an infection caused by fungi and it usually takes root on the surface of the skin. It can be obtained when pasture cows are forced to walk in the mud to get water. However, it can also occur in paddock cows, and there are 5 symptoms of foot rot. Symptoms of foot rot are extreme pain, leading to the sudden onset of lameness, elevated body temperature, bilateral swelling of the interdigital tissues around the hairline and coronary band of the hoof, necrotic lesions in the interdigital space with a foul odor, and decreased feed intake. So, to prevent foot rot, one of the easiest ways to prevent foot rot is to manage the cattle in a clean and dry environment to minimize the mud exposure. Some producers advocate including iodine in the mineral mixes or as a feed supplement. So in order to cure foot rot, systemic antibiotics generally work well if the infection is caused early. If infections is long-lasting, you may have to clean up the foot, floss between the toes with clean rope, twine or a towel to remove necrotic tissues, and lastly, apply a topical antibiotic such as oxytetracycline. Is a disease characterized by acute inflammation of the upper respiratory tract. This disease can affect young and older cattle. Can also sporadically cause abortion in cattle and affects animals' health and productivity, causing different economic losses to cattle producers. So be transferred through via respiratory aerosols or from direct contact with infected cattle. In addition, the possible sources of the virus include new additions or sharers to the herd, vaccines, birds, or wild remnants. So the symptoms of these are fever, coughing, depression, loss of appetite, hyperemia of the mucosal lesions, nasal discharge, conjunctivitis, drop of milk production, infertility, and abortion. So, there is no direct treatment for viral disease. Infected animals should be isolated from the rest of the herd and treated with anti-inflammatory drugs and antibiotics for secondary infections if necessary. Carrier cattle should be identified and removed from the herd. So PPR or goat plague, also known as a sheep and goat plague, is a highly contagious animal disease affecting domestic and wild small ruminants. It is caused by a virus belonging to the genus Morbillivirus family, Paramyxoviridae, and the symptoms of PPR are similar to those of rinderpest: fever, anorexia, depression, nasal and ocular discharge, difficult respiration, necrotic lesions on gum, lips, and tongue resulting in salivation, erosion on the nasal mucosa, and finally, diarrhea. So as the result, PPR can now be controlled by focused vaccinations in high-risk populations of sheep and goat, followed by mass vaccination campaigns. Mass vaccination campaigns must achieve high levels of herd immunity from 70% to 80% to block the epidemic cycle of the virus. Last one is the bovine babiosis or the tick fever. Bovine babiosis or BB is a tick-borne disease of cattle. Transmission of BB takes place when engorging adult female ticks pick up the infection. They pass it to their progeny via their eggs, larvae, or seed ticks, then pass it in the turn when feeding on another animal. So the symptoms of this disease is high fever, neurologic signs such as incoordination, teeth grinding, and mania. Some cattle may found on the ground with the involuntary movements of their legs. When the nervous systems of cerebral babiosis develop, the outcome is always fatal. So, another one is dark colored urine. Anorexia. Animals likely to separate from herd, be weak, depressed, and reluctant to move in. How to eradicate this disease? So to eradicate this disease, it can be done by eliminating the host ticks.